Welcome to today's webinar on billing human immunodeficiency virus or HIV screening. My name is Karen Curtis, and I am a provider outreach and education specialist here at WPS Government Health Administrators. I'm joined today by my friend and teammate, Aline Sigler. Aline's going to be monitoring the chat and will provide some additional information when needed. Preventive services has come up in our surveys as a topic that you would like to see included in future webinars. So we decided to make it into a series. This way, we can take individual services and cover them in a little more detail. Earlier this month, Jennifer, who is part of our clinical staff, covered the topic of HIV screening, and she focused more on the medical coverage aspect. And we're kind of going to be doing the same thing moving forward. You're going to continue to see these topics split into webinars that focus on billing and webinars that focus more on the medical policy. So you'll want to make sure to pay attention to the course descriptions when you're registering that one. That way you'll know which one you're registering for. This next slide is our disclaimer. We do our best to provide the most current, accurate information, but as we all know, Medicare rules change often. The information that I am presenting is accurate as of today, but the CMS website should be checked often for updates. CMS prohibits recording of this webinar for profit-making purposes, so that we ask that you don't record the presentation. This event is being recorded and will be posted to the WPS website as well as our YouTube channel as an encore. Our new website does contain a player that will allow you to view these presentations on the Encore Presentations webpage. I'll talk a little today about how coverage for preventative services came about. We'll discuss specific services covered by Medicare, and finally, we'll talk a little bit about how to check patient eligibility. First, let's talk about the Affordable Care Act and the U.S. Preventive Services Task Force. The Affordable Care Act and the U.S. Preventive Services Task Force, or Task Force, has helped make preventive services more accessible to beneficiaries. The Affordable Care Act was signed into law on March 23rd of 2010. It required healthcare plans to provide certain services, immunizations, and screenings without cost sharing. The hope was to eliminate some of the out-of-pocket expense so that more individuals would be open to receiving preventive care. This act also increased access to services by making it unlawful for any healthcare provider who receives federal funding to refuse to treat individuals based on race, color, national origin, sex, age, or disability. The task force is a volunteer group that was created in 1984. The 16 members consist of national experts who come from a variety of fields, including family medicine, behavioral health, and nursing, among others. These individuals make evidence-based recommendations regarding preventive services offered in a primary care setting or services that are referable by a primary care clinician and apply to patients who have no obvious signs or symptoms of any specific disease. Each service is reviewed to determine if there is evidence that the service is effective and the balance of benefit versus harm. A letter grade is then assigned, and those that receive a grade of an A or a B are offered without cost sharing. Now that you've heard some of the background, let's get into the specifics of billing for HIV screening. HIV screenings is a service covered under Medicare Part B for beneficiaries who are not considered to be at risk for contracting HIV, for individuals who are deemed to be at increased risk, and those who are pregnant. The task force has assigned a letter grade of A to this test, so there is no out-of-pocket expense to the beneficiary. A maximum of 1 annual voluntary screening is covered. For pregnant beneficiaries, HIV screenings are covered 3 times throughout the pregnancy. I'll talk a little bit more about this when we discuss eligibility. CMS has added some age guidelines to the coverage criteria. Adolescents and adults aged 15 to 65 are eligible to receive an HIV screening regardless of their risk for infection. Individuals younger than 15 or older than 65 are covered if they fall into the increased risk category. Pregnant beneficiaries are covered regardless of age. This test would not be covered for beneficiaries who have been diagnosed with an HIV-related illness. You may be wondering what CMS considers increased risk. This is not an all-inclusive list, but it would include men in sexual relationships with other men, men and women having unprotected sex, past or present injection drug users, sex workers and their partners, people who have received a blood transfusion between the years of 1978 to 1985, those who have a new sexual partner, and individuals who a physician has deemed to be at high risk based on an individualized interview and examination. Physicians would be able to determine increased risk when assessing the patient's medical history. This usually takes place at the annual wellness visit, and it should be documented in the patient's medical records. Let's get into how you're going to submit these claims to Medicare. If you submit your claims on a CMS 1500 or an 837P, you're going to want to include a place of service of 81 for an independent laboratory or 11 for office. If you submit your claims on a CMS 1450, also known as a UB04, or an 837I, you will want to use one of the type of bills listed here. And the services should be billed using a revenue code in the 300 range for laboratory. The codes listed on this page are applicable regardless of what form you use. The codes listed in the column Procedure Codes are used to report what type of screening was used. Code 80081 is for an obstetric panel and would only be applicable if the patient was pregnant. If the obstetric panel is used, there are certain tests that must be included. The preventative services, the Medicare Preventative Services tool gives details, and we're going to take a look at that when we get to our resources slide. They do have very specific tests that must be included in that panel. All claims must have a primary diagnosis of Z114. One of the pre-submitted questions that I received asked why screening services have different codes that basically say the same thing. Why couldn't there just be one code that covers all screenings? And the simple answer is it's basically for tracking purposes. When ICD-9 was switched to ICD-10, there were nearly 5 times as many diagnosis codes. And according to the World Health Organization, they gather all of this information, and it's used to support payment systems, resource allocation, and health statistics. So now we're going to take a look at the secondary diagnosis codes. So if you are billing for a pregnant beneficiary, There are many secondary codes to choose from. Codes are first broken down into the type of pregnancy. So you'd have first normal pregnancy, a normal pregnancy, and then high risk. And then after that, the codes are further broken down into the different trimesters. I have to apologize for the first normal pregnancy. This should also include diagnosis code Z3400. I'm sorry that got left off this slide, but that should also be included. The normal pregnancy is further broken down into normal pregnancy versus normal pregnancy unspecified. And the codes, if it's just coded as a normal pregnancy, that would be used when you know that this is not the patient's first pregnancy. If the code normal pregnancy unspecified is used, that means that it can't be determined if it's the patient's first pregnancy or not. If the patient is between the ages of 15 and 65, a secondary diagnosis is not required. And that would be because they are considered to be, they're giving a voluntary test at no increased risk. Beneficiaries who are considered to be at an increased risk should have a secondary diagnosis which further identifies the specific behavior. So these codes are going to include if it's a problem related to the lifestyle. They also have codes for heterosexual, homosexual, or bisexual behavior. There are codes within the system that if you do not report a primary diagnosis code of Z114, that will result in the test being denied. I want to take a little time to talk about patient eligibility so that you will know when the patient is eligible for their HIV screening. I'll take a moment to go into a little more detail regarding frequency. For non-pregnant beneficiaries, regardless of the risk factor, HIV screening is covered annually. So that's 11 full months have to have passed following the month in which the previous test was performed. So, for example, if the patient received the screening in January of 2023, you would start counting the 11 full months in February. So that means the patient would next be eligible to receive the screening would be in January of 2024. For pregnant beneficiaries, there's up to 3 screenings that can be covered per pregnancy. The first one would be at the time the beneficiary receives the pregnancy diagnosis. They would be eligible for the next test during the 3rd trimester. And the final test would occur at labor if it's clinician ordered. So you have a few options available for determining a patient's eligibility date. Information can be accessed at any time using the Interactive Voice Response System, or IVR. The system will require verification by entering your MPI, Provider Transaction Access Number, or PTAN, and the last 5 digits of your tax identification number. I personally do not have access to the IVR, but you should be able to obtain the CPT or HCPCS code that was billed, along with the date of service that test was performed and the provider of the service. You will need the patient's Medicare number, their first and last name as it appears on their Medicare card, and the date of birth. The secure section of our website is referred to as the portal. The eligibility check option can be found under the My Transactions heading, and you will need to enter the patient's Medicare number, first name or date of birth, last name, any suffix if applicable, and the starting and end dates of the service. This option will give you the procedure code and when the patient is next eligible to receive the service based on the dates you entered. If you are a Part A provider who bills using the Fiscal Intermediary Shared System, or FIS, direct data entry would be another available option. At the main menu, select a 01 for inquiries. You would then choose option 10, which is the beneficiary common working file information. After entering some key data, you'll have access to 6 pages of eligibility information. If you are doing an HIQA inquiry, the HIV screening information can be found on page 7. I did check the HEP companion guide, but I couldn't find where HIV screening test was on the list of preventive services, so I don't believe that you would be able to get this information from the 270, 271 transaction. I've provided some resources in regards to the HIV screening. I do want to go out to the Medicare Preventive Services tool. Give me just one moment here. Aline, can you confirm that you can see the Preventive Services tool?
Yes, I can see the Medicare Learning Network.
Okay, great. This resource is great regardless of what type of preventive services you're looking for. As you can see, it lists all of them out here. These ones that have a T with a circle in it, that means that they are telehealth eligible services. Now, this does not give you as much information as what you would find in the internet-only manuals, but if I go to HIV screening, it gives you a link to the national coverage determination that's related to HIV screening. It goes through the covered codes, and here's where I was talking about if you are providing the obstetric panel, it gives you a list of what it must include. So it lists all the other tests out there that must be included in that panel. If you go down here, it will give you the ICD-10 codes that are required. This doesn't go into as much detail as the manual. The manual does have it broken down into the pregnancies or the risk behaviors and the trimesters. It goes into the frequency, the payments, but it does have a lot of the annual wellness visits is out here showing that it's telehealth eligible. It is really just a great tool to use. Let me go back. Aline, can you confirm that you can see the PowerPoint presentation?
Yes, you are back on the PowerPoint.
Okay, great. Okay, do we have any questions that have come in?
I do not see any questions in the chat right now. I did put a little reminder there to everybody. So if you do have a question that's related to today's presentation, you can drop it in there and then we can address it for you.
Okay. Well, thank you for joining us today. Keep an eye on our live events page for upcoming webinars. The Preventative Services series is going to continue, and we will be breaking those down by the individual services so they can be covered in more detail. Jennifer will continue to provide the clinical coverage criteria with documentation. I'm going to focus more on the billing half of the preventative services. And so, like I said, you'll just want to pay attention to the course description so that that will let you know if you're registering for the clinical portion or for the billing portion. On behalf of Provider Outreach and Education, thank you so much for your participation today. We look forward to your survey comments, and we hope to have you join us for future events. You may now disconnect.